We will be discussing the anatomy of the heart. So, as usual, my name is Wadistigi Munyidi, and I'm the Uri Daktari. So, ladies and gentlemen, shall we do this? So, what will be the scope of this lecture? So, we discuss the pericardium, okay, and then under the pericardium, we discuss the parts of this pericardium, and then the pericardial recesses, and then discuss the great vessels of the heart, and then for that, we look at the external features of the heart. And at the external features, we discuss surfaces, borders, screws, and the sulky. Okay, so let's start that. You could give me a minute. I hide this. Sorry for this. Let me just hide these floating meeting controls. Let's start. Now, um, let this. Okay. So whatever you can see here is the pericardium, the fibrous pericardium. Okay, so this is the fibrous pericardium. So the fibrous pericardium actually divides the inferior mediastinum into three. So whatever is anterior to the fibrous pericardium is within the anterior mediastinum. And one of the content in the anterior mediastinum is here, and this is the thymus, okay, the thymus. And then any content within the fibrous pericardium is in the middle mediastinum, and any content posterior to the fibrous pericardium is within the posterior mediastinum. Okay. Then on either side of the fibrous pericardium, so the heart is located within this fibrous pericardium, and you can see this is the diaphragm. You can see that the fibrous pericardium and the central tendon of the diaphragm, they are actually continuous. Okay, they are actually continuous. And then you can see this, that is your right lung, the left one, and you can see anterior to the root of the lung, you have the phrenic nerve. Then accompanying the phrenic nerve are the pericardiocophrenic, pericardiocophrenic uh, vessels. Okay, so those vessels come from the internal mammary or the internal thoracic artery, which came from the first part. So those vessels supply the fibrous pericardium. Okay, the other vessels which supply the fibrous pericardium are the esophageal branches which come from the descending thoracic artery, and also the bronchial arteries, uh, which have a different origin on the right versus on the left. Okay, so that's the fibrous pericardium. So when we cut this fibrous pericardium of ours, lining the inner surface of this fibrous pericardium is the parietal layer of the serous pericardium. Okay, so the serous pericardium has two layers: a parietal layer lining the inner surface of the fibrous pericardium, and a visceral layer which lines the external surface of the heart. That visceral pericardium, the visceral serous pericardium, is also known as the epicardium. Okay, the epicardium. So these two, the parietal and the visceral layers, they are actually continuous at at the at the root of these great vessels. Okay, at the root of the great vessels, the two layers are actually continuous. Okay, as if they have been reflected at that point. Okay, they're reflected on each other at that point. Okay, and then between now the serous, the parietal layer of the serous pericardium and the visceral layer, you have between those two layers, you have a potential space known as the pericardial cavity, which in life is filled with a thin film of a fluid known as the pericardial fluid. Okay, the pericardial fluid, which allows the heart to 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 be to move in a friction-free environment. Okay, in a friction-free environment, and there it is. Okay. So these are the great vessels. Okay, so you can see superior vena cava here, and you can see the superior vena cava being formed by the right and the left brachiocephalic veins at the level of the first costal cartilage, and then it pierces the fibrous pericardium. It has been hidden from view. Let me go back. So you can see it piercing the fibrous pericardium at this point. That is at the level of the second costal cartilage, or along that transverse thoracic plane, which passes through the sternal angle fluid, and then it drains into the right atrium at the level of the third costal cartilage. So things in the superior vena cava happen in 1, 2, and 3. Okay, so 1, formation, 2, piercing, 3, drainage. Okay, um, so discussing about now the pericardial recesses. So the pericardial cavity has two recesses or two sinuses. Wherever that finger there has passed through the transverse sinus, and you can see the transverse sinus is posterior to the arteries. It is posterior to the ascending aorta and the pulmonary trunk, but you can see it is anterior to the superior vena cava. This is the superior vena cava. So that's the transverse sinus. How was it formed? It is due to the degeneration of the dorsal mesocardium when a dextro, or rather when cardiac looping was occurring. So when this heart was folding upon itself so that the arterial end comes closer to the venous end, that mesocardium posterior to that part degenerated, okay, and it gives that transverse sinus. The other sinus is the oblique sinus. This hand has been placed into the oblique sinus. So the oblique sinus, what is important for the oblique sinus for you to remember is actually, let us see that. So the oblique sinus will be located somewhere here. The fingers were placed somewhere here, so that the right border of the oblique sinus is actually the inferior vena cava, and the right pulmonary veins, that is the superior and inferior, and then the left boundaries, these are the left pulmonary veins, okay, and then superiorly, it is actually a blind sac. It's a cul-de-sac, okay? It's a blind sac. It's a blind pouch, okay? So what you need to remember is that the relations, the oblique sinus is just posterior. It is just posterior to the base of the heart, mainly the left atrium, okay? So the left atrium is the anterior relation of the oblique sinus. Then posterior to the oblique sinus will be this fibrous pericardium overlying the esophagus here, okay? So when you want to perform procedures such as the transesophageal echocardiography, you can visualize the left atrium through the esophagus thanks to that oblique sinus, and so the the device will be placed in the esophagus somewhere there, and it will be able to visualize the left atrium, which will just be anterior to the esophagus at that point. Okay, so these are the great vessels which have been cut, and let us discuss the great vessels. So that is the ascending aorta there. That is the arch of the aorta, that point. And then from the arch of the aorta, you can see you have three vessels taking origin: the innominate artery or the brachiocephalic trunk. Then you have the left common carotid and the left subclavian. Okay. And then here you have the pulmonary trunk, which divides into a right pulmonary artery and a left pulmonary artery. And then you can see at this point, the pulmonary trunk is joining the aorta via that is the ligamentum arteriosum, which is the remnant of the ductus arteriosus. Okay. Now the interesting thing is, see where the aorta is in relation to the left ventricle, and where the pulmonary trunk is in relation to the right ventricle. Okay, it's as if these two things have payload on each other. Okay, so the right ventricle is to the right, but the pulmonary trunk is to the left. Okay, so it is, the blood will be moving in that uh, direction. Okay, but then the aorta is to the right, but the left ventricle is to the left, so blood will be moving in that direction. How did that come to be? I will tell you in the next slide. And then this is the superior vena cava, and you can see the superior vena cava there being formed by the right, the left brachiocephalic veins, and you can see one of the tributary to the left brachiocephalic vein is that thymic vein, okay, the thymic vein draining your thymus, okay. So that was the ligamentum arteriosum, okay. So how did that happen? Now it goes back to the story of embryology of the heart. So you have what is known as the truncus arteriosus and the bulbus cordis. So the truncus arteriosus is the arterial end. It is what ideally should give you the aorta and the pulmonary trunk. Then the bulbus cordis gives you the outflow tract of the two ventricles. So on the right, it will give you conus arteriosus or the infundibulum, and on the left, it will give you the aortic vestibule. Okay, so these two parts, the truncus arteriosus represented by T and the bulbus cordis represented by B, undergo what is known as phonotruncoceptation. Now, you form two ridges, a truncal ridge and a bulbar ridge. So these ridges are of the mesenchyme which forms those ridges is of neurocrest origin. Now, the way that septum forms, the conotruncoceptum or the aorticopulmonary septum, you can see it is spiral. Okay, it is spiral. So you need it to be spiral, and for that reason, that is why these vessels, the great vessels which take origin from the ventricles, spiral on each other. Now, what could go wrong? If this aorticopulmonary septum fails to form, you can have a patent truncus arteriosus or a persistent, let us use in fact the term persistent truncus arteriosus, okay? And that will lead to cyanosis, okay? You also, if this aorticopulmonary septum does not spiral, you can have transposition of the great arteries. Now, what else could go wrong? If this aorticopulmonary septum does not uh, occur within the midline, so let's say it is displaced anteriorly, this pulmonary trunk will be stenosed. So you have pulmonary artery stenosis. You also have an overriding aorta. Those two are accompanied by a ventricular septal defect, and because this pulmonary trunk is stenosed, the right ventricle will pump blood against high pressure, so it will undergo hypertrophy. So those four, that tetrad is the classical feature of the tetralogy of Fallot. So those anomalies which I've tried to explain here, I have a good YouTube video. Take your time, listen to that YouTube video. I'll put the link maybe at the end. Stay tuned. Then still these are the great vessels, superior vena cava at that point, inferior vena cava at that point after passing through the caval uh, opening at the T8 vertebral level. Okay, so these are now the surfaces and the borders of the heart. So this is the anterior view of the heart, and you can see we have a right border over there extending from the T3 to T6, which is mainly formed by the right atrium. And then here you have the inferior border. Inferior border will be over there, now separating the sternocostal surface from the diaphragmatic surface, the surface which lies on the central tendon of the diaphragm. So that's the inferior border. Then near the apex, that inferior border usually have a notch. It has a notch, which is known as the incisura apicis cordis. So it's simply an incisor or incision near the apex of the heart. So incisura apicis cordis. So it is mainly formed by the right ventricle, but towards the apex, the left ventricle will also contribute, and also the right atrium contributes to the right most part of the inferior border. Then you have the left border over there, which is mainly formed by the left ventricle, but also the left auricle contributes. Okay, so this is the sternocostal surface, and you can see it is majorly formed by the right ventricle, which is that, and also the right atrium and the left ventricle. And then you can see at that point they are not so well demarcated because of this epicardial fat. That's the anterior interventricular groove housing the left anterior descending artery, which is also known as the anterior interventricular branch of left coronary artery. Okay, so that's the apex. So what is the surface landmark of the apex? It is the fifth intercostal space, 9 centimeters lateral to the median plane. Okay, so if you have the median plane along the fifth intercostal space, 9 centimeters lateral to it, or fifth intercostal space, mid clavicular line, somewhere just medial to the mid clavicular line. So that's the location of the apex, and that is where the heartbeat is uh, most or best appreciated at that point. Okay, best appreciated at that point. Okay, so this is what I was showing you, the anterior interventricular sulcus over there, interventricular sulcus, left ventricle, right ventricle. So what is separating the right atrium from the right ventricle? It is the atrioventricular groove, which moves around the heart. It completely encircles the heart. So for that reason, it is akin to a crown. So coronary sulcus, okay? Anything related to a crown has has the prefix coro. So coronavirus, coronation, coronary sulcus. Okay, it encircles the whole heart like a crown. Okay, and you can see this ear-like appendage of the right atrium known as the right auricle over there. So, what structures do you expect to find in the coronary sulcus? This is actually the right anterior part of the coronary sulcus. This part here will contain the right coronary artery. Okay, the right coronary artery, and then the anterior cardiac veins will be crossing that sulcus and draining into the rough part of the right atrium, or rather the right atrium proper. Okay, the anterior cardiac veins. Okay, and then this is the anterior interventricular sulcus over there. It houses the anterior interventricular branch of left coronary artery, also known as the left anterior descending uh, artery. Okay, so this is an inferior view of the this is now the diaphragmatic surface. Okay, this is a diaphragmatic surface over here, and you can see that it is this. This is here. This here is the left ventricle. So left ventricle forms majority of it. So 2/3. Then a third is by the right, and then in between the two you have the posterior interventricular sulcus, and in there you have the posterior interventricular artery. So that artery most most likely comes from the right coronary artery. Okay, so the posterior interventricular artery determines coronary dominance. Okay, so if it comes from the right coronary artery, that heart is said to have right coronary dominance. If it comes from the left, which happens in minority of the cases, it is the heart is said to have left coronary dominance. Okay, and then another structure found there is the middle cardiac vein. Okay, this here uh, this here most likely is the posterior vein of the left ventricle. Okay, and you can see it going to the coronary sinus. This is the coronary sinus still within the coronary sulcus. Okay, so that is that. Okay, so now this is the base. This is the base of the heart, and you can see the 4 pulmonary veins opening into the left atrium. Okay, and you can see part of the base is also contributed by this. This is now the right. Uh, this is now the right atrium. Okay. Then another point which maybe I should have pointed to is we have this point here. Okay, let me try to draw it. Where now the posterior interventricular sulcus meets the coronary sulcus, and also at that point you have this sulcus here, which is the interatrial sulcus. So at this point here, you can see somehow a cross is being formed. So that is the crack of the heart. Okay, the crack. So that's the cracks of the heart. And at the cracks of the heart, the right coronary artery, anastomosis is the left coronary artery. Okay, the crack of the heart. Okay, so that is said. And then see, this is the base. You can see the left atrium. You can see the palpitations and whatsoever. Okay, so can see how the coronary sinus, this is the coronary sinus. You can see some tributaries, the oblique vein of the left atrium, which is also known as the oblique vein of Marshall, then the pericardiac vein, the left marginal vein, and also the posterior vein of the left ventricle, and also the middle cardiac vein. So those are the 5 tributaries to the coronary sinus. And when we do um, um, the internal features of the right atrium, you actually see the opening, the coronary sinus ostium. Also, you have the small cardiac vein there. So this is a superior view, still the same. That's the aorta, pulmonary trunk. This is the left auricle. So if that's the left auricle, this here at this point already, this is the left anterior descending. Okay, this is the left anterior descending. Now, if I reflect this auricle in that direction, if I reflect it, I'll see the circumflex branch moving along the coronary sulcus in that direction. Okay, and this here, this is the right, that's the right auricle, that's the right auricle, and this here is the right coronary artery. Okay, the right coronary artery. So a better view, you can see the right coronary artery here, and you can see the sinoatrionodal branch. That branch goes to the SA node. Okay, and then you can see some vessels crossing this right anterior part of the coronary uh, sulcus. Those are the anterior cardiac veins which drain into the right atrium proper. Okay, and then here you can see this is the ventricular branch of the right coronary artery. Okay, it gives both ventricular and atrial branches. Okay, and then still this is the, now at this point, this is the left coronary artery. It is simply a short trunk, and you can see it bifurcating to the left anterior descending. And now this other one is the that's none other than, that's the circumflex branch of the left coronary artery. Let's see if we can have a better view. See, this is the right coronary giving off the right marginal branch, which supplies most of the anterior wall of the right ventricle. This is the right ventricle. That's the right atrium. Okay, and then this is the left anterior descending. Okay, and you can see this notch here, which I said is the incisura apicis cordis, incisura apicis cordis, and at that point, the right, the left anterior descending continues, or rather anastomosis with the posterior interventricular artery. Okay, incisura apicis cordis. Great. So that's right coronary. You can see it, and you can see clearly at this point, the posterior interventricular artery is being given off by the right coronary artery. So this heart has what is known as the right coronary dominance. Okay, and then this is the middle cardiac vein. This is your coronary sinus, and this is the posterior vein of the left ventricle. This is the left marginal vein. You can see all of them draining into the coronary sinus. Okay, coronary sinus. So now this is, you can see clearly, this is the left coronary. You can see it is simply a short trunk which immediately bifurcates to the anterior interventricular branch, which is also known as the left anterior descending, and you can see the circumflex branch there. And then from the circumflex branch, you can see we have the left marginal uh, uh, artery. Okay, left marginal artery. These are simply the tributaries. You can see the various tributaries to the coronary sinus, which you can consider it as a continuation of the great cardiac vein, which is joined by other veins before termination. And that's it. It was that easy. So I'll put the link. I'll put the link. And with that said, have a wonderful day and keep studying, keep studying, keep studying. Thank you very much.